We lose about 5 North Carolinians every day to an opioid overdose. It's the leading cause of accidental death in our state, more than car crashes. This crisis of overdose and addiction is fundamentally one driven by overprescription of painkillers. They get hooked, they can't get any more of those pills, so they go on the street where they get heroin, which is cheaper and more plentiful.
Talk to me. Hi, Bob. Open your eyes.
The power of the narcotic over the person is unbelievable. We're seeing overdoses from the age of 17 to 70 with heroin and heroin derivatives in this community.
This is happening to your family. This is happening in your schools. This is happening at your workplace. This is everywhere.
It's a catastrophe. It's heartbreaking. Every single opioid overdose death is preventable.
I'm Jim Gray, Michael Tabor Gray's father.
I'm Sandy Tabor Gray, and I'm the mom of Michael. Michael had a great sense of humor. You know, he was a very happy kid. He broke his arm severely when he was like 15. He was prescribed opiates. And then I think it was just getting it however he could. So he was getting it from other kids. He was taking it from other kids' parents' medicine cabinets without them knowing. And then he was buying it, you know, when those options were gone. We were off to Tennessee to take him to treatment. And that is where he met the woman. Before he was even 19 years old, he found out that she was pregnant with twins. Somewhere at this time is when he was introduced to heroin.
And then we made arrangements to go to another treatment center.
So Michael came home on the weekends. We'd had a great day. And, you know, then he asked if he could go out and meet up with some friends and go to a meeting and come home later. And he came home right when he said he would. He kissed me goodnight and he hugged me and he told me he loved me like he always did. And he went upstairs to bed and then I went to bed. The next morning was Sunday. I could hear the kids upstairs and got them out of their cribs and we all go traipsing in there. They're calling Dad and I'm, you know, Michael. And he didn't move and honestly, I didn't think too much about it because he's a very sound sleeper. So I walked over to the bed to gently, you know, touch him, and he was cold.
Autopsy results came back after several weeks, and it was ruled an accidental overdose of heroin.
Yeah. And there was fentanyl in there.
We didn't find the tube of toothpaste yet, did we?
Yeah, I'd like to find out.
Oh, I see it.
I did.
It's not a matter of if we tell them the truth of his overdose, it's just how and when.
I don't want them to think they have anything to be embarrassed about with their dad, because it is a disease.
I'm TRINLIE YEAMAN, and Zoe was my daughter. An amazing child, absolutely gorgeous. She was very smart, talented, played sports. Her first real boyfriend's father had cancer, and he was giving his son the pain pills, and then he was giving them to Zoe. She was coming home and, you know, she was just not acting right. One night she was really upset, couldn't really talk to me, and then she pulled her sleeves up. And when she pulled her sleeves up, I saw the marks, and I fell to the ground and cried. I mean, it was devastating. So then I started looking for rehabs, and there was nothing Everything was private. There's no rehab that's affordable for adolescents. I was really depressed. I was trying so hard to get this child help, and there was nothing. So he suffered from depression and anxiety. She flipped out in front of her dad, and he called me, and I said, let's take her to the hospital. She was there for almost a week, and she turned 18 while she was in there. I talked to him and I said, can you please, now that she's 18, I've got her on a list for a bed because she's considered an adult now. And I said, can you all please hold her until the bed becomes open? It's gonna be 2 weeks maximum. And they said, no, this is the mental health ward, not addiction facility, and she's stable mentally, so we're gonna have to release her. She came back home with me and was home with me for about a week and a half. On a Tuesday, she said, I would want to go see Dad. She already had set up with her ex-boyfriend, the one that got her addicted. The phone rang, and it was her dad, and he was hysterical because he went in to wake Zoe up. It was probably about 6 or 6:30 in the morning, and she was not alive. The house was just overcome with EMTs and police officers, and they had her out on the floor doing CPR on her. I asked if I could just hold her hand, you know, maybe if she knew that I was there, maybe she would come back. So my last memory of my daughter is laying on the floor next to her. And I grabbed her. I remember grabbing her hand and trying to warm her up. 3 hours after they took her body away, the rehab called me and said they had a bed for her. A parent should not be left dangling out alone on their own. There should be more resources. I mean, she has so much to offer this world, and we're not going to get to see it.
The prescription opioid and prescription medication issue that we are seeing in Guilford County is really unprecedented. The instance of occurrence of response to opioids used to be something that was a once or twice a week event. We're seeing it now multiple times a day. We've had as many as 7 overdoses in a single day. All of the providers within this system carry naloxone, so that is the reversal agent, and they can be administered by law enforcement officers, by firefighters, or by paramedics.
48-year-old male, lethargic, semi-responsive inside the laundromat. Was talking to us initially denied any drug use. However, his pupils were pinpoint. Respirations were continually slowing. So definite heroin overdose, known user, fixing to administer Narcan. Respiratory rate's about 6 a minute right now. Talk to me. Hi, Bob. Open your eyes.
I'm talking, I'm fine.
You're talking, you're fine.
Yeah.
Hey, now you come around to us.
Yeah.
You went out on me.
I went out on it?
Yeah.
You did.
Wow. Not really. I mean, I've been pretty much,
You remember everything that happened?
Yeah.
So you remember stop breathing?
No, I don't remember stop breathing.
Okay, do you remember us putting the tube down your nose?
Yes.
Okay.
One of the things about opioids is that they depress the central nervous system, and as such, they're immediately life-threatening because people do not breathe adequately when they overdose.
Okay. Well, listen, partner, you're not in any trouble. I just need to know because I had to give you Narcan to get you breathing again. Okay?
All right.
So be straight. I need you to shoot straight with me.
Sure.
When's the last time you used?
Haven't.
Eventually, he did admit to using what they call on the street $5 or $5 bag. Stated it's from his typical supplier, was his typical dose, but evidently had been cut with something different than what he was used to.
When people transcend over to the illicit market, they simply are not aware of the strength of what they are purchasing.
You're willing to accept the risk that you could possibly die from this, correct?
Yes, I do. But I'm not going to.
There's always a question whether naloxone facilitates continued narcotic use. In no way do I think it facilitates narcotic use. What I think it does is prolongs the opportunity for life for the patient until we can get them into treatment.
A lot of people don't realize Wilmington, North Carolina is the #1 city in the U.S. for opioid abuse.
I know you got some dirties for me.
Okay, I got around 250.
All right, take 2 grab bags.
Yeah.
And then some naloxone. How many naloxones do you want?
Give me 2.
We collect the dirty syringes that they may have. We give them clean syringes, as well as other things that will prevent Hep C and HIV. And we also give them resources like referrals for mental health needs or substance abuse needs.
You know about the harbor if you need to get into detox. You know, I've got access to treatment if you want treatment.
I do get frequent phone calls from people saying, oh, you're enabling, or oh, you're adding to the problem. Yeah, I'm enabling them to be HIV and Hep C free. Sure, I'll own that. I would also say to them that 8% of the people that I engage with have sought recovery because of the resources and referrals that they've gotten through our syringe exchange program. I would say to them that we've collected close to 30,000 sharps off the streets of this county where people are playing, where kids are playing.
So Don, I just wanted to make sure you had adequate supplies for you and your crew for the week. So I've got 300 clean insulin syringes. I know you've got some.
HIV decreases by 80%, Hep C decreases by 50%. Crime actually goes down by 11% because people are getting resources.
I think what Mike does for this area is great.
Should be good. And did you have any dirties to turn in today?
Yeah, I can just give you. Keeps the trash off the streets, keeps people from sharing, just keeps you safe. My drug use started, as I consider it late in life, you know, listening to other people talk. I was probably 33, 34 years old before I started, you know, messing around. I would say my heroin use it probably has affected my relationships with family. With non-using friends, it has distanced those relationships. I think about quitting every now and again. I can't see myself as a grandfather, you know, bouncing my grandkids on my knee, being a active heroin user. So I'm hoping that, you know, my attitude will change towards it, you know, sooner rather than later.
I had a family member that had went through a surgery, and I saw another family member of mine begin to take medications from them, and I repeated the behavior. I was 12 years old when I first did this. Prescription pills were usually opioids. It snowballed. A friend of mine, you know, he'd always bring around heroin. It was just one of those things where I tried it, and I was like, well, I really like this, you know? I liked the whole aspect of snorting and everything, and then that eventually evolved into using an IV. I definitely knew that I had crossed the line. I definitely knew that I had done something that was going to be very hard to stop. But I would always tell myself that I could stop whenever I wanted to, but I just didn't want to yet. I really destroyed my relationships with my family. When I was sleeping in the Walmart parking lot, I was like, this is not sustainable. I think the one turning point was that I realized that I was never going to be able to amount to anything with the way I was going. And I decided, you know, that I had to do something, and that's when I made a call to a friend who took me to detox.
One of the largest obstacles or barriers to people receiving treatment is just simply the stigma, the shame and the guilt and the stigma attached to addiction in and of itself has a lot of people scared to even ask for the help that they need. Another obstacle to treatment is just simply the fact that there's just not enough. People are either uninsured or underinsured. Even if they do have insurance, there just simply aren't enough treatment beds to fulfill that capacity of people that need the help. Addiction is a chronic illness, really no different from diabetes or heart disease or any other chronic illness. And if we don't treat it as a chronic illness, then all we're doing is throwing money down the drain, because our prisons will continue to be filled, our emergency departments will continue to be filled, and the human suffering and the human pain will be astronomical as it is today.
My clean date is September the 20th of 2015. I had seen, you know, what it was like to really enjoy and live life and not just go through it and just looking for something. You know, I wasn't looking for anything anymore. I'd found it.
Stop acting, stay on the wall.
The STOP Act was the state's primary effort to address the growth in the number of people who are addicted. First, it sets a limit on the number of pills that a doctor can prescribe for acute pain as distinct from chronic pain. It also requires doctors to check a database to make sure that patients are not doctor shopping, and it requires doctors at some point soon to do e-prescribing to reduce prescription pad forgery and theft. All in all, it's about reducing the number of people who become addicted in the first place, and it's working.
$10 million is a good amount of money, and we were able to get about 5,000 or 6,000 people into treatment over that period of time with just that money. But I will say it feels a bit of a drop in the bucket when we know how many folks actually still do need treatment.
It is against the law to trade in heroin. It's against the law to trade in various forms of illicit fentanyl. But fentanyl is something that's created in a lab, and the bad guys are constantly reformulating it, coming up with new chemical derivatives. Not every derivative was actually illegal under North Carolina law, and there was one type of fentanyl that had killed more than 77 people just in 1 year alone that was not against the law. So the Synthetic Opioid Control Act closed those loopholes in state law so that when we find these drug traffickers, we can actually hold them accountable. The HOPE Act is an effort for us to give tools to law enforcement so they can hold illegal drug rings accountable. It also made illegal certain acts by healthcare providers where they were actually taking pain medication from patients who needed them, stealing them and diverting them to the drug trade, and we increased those penalties. So that when they go to the doctor, they can have a conversation about what are other ways to treat my pain other than these painkillers, which are addictive. If I need these pills, what should I do to safeguard them so that my niece or nephew don't get their hands on them? All of this is on the website, morepowerfulnc.org, and we just want to empower people so that they can take action to help us fight this scourge.
So our current action plan really has three components. One is making sure folks have access to treatment. Second is thinking about making sure folks can get access to prevention. So that's about education campaigns, making sure that we're doing good prescribing of pain medicine. And then the last is making sure that we're reducing harm. We know that not only is death a possibility when folks are using opioids, but there are other harms that can come related to the opioid crisis. The opioid crisis is a complex problem. We got here over 20 years of a lot of things going wrong, so there's no one single solution that's going to get us out of it. So we know we needed a comprehensive solution that was going to take many sectors. I'm very proud of where we've come from 2017 to 2019. For the first time, we've actually seen a leveling off of the crisis, right? We're not accelerating the way we were. I want to see it decrease. A lot more work to do. We need folks to get access to treatment, and we need to get at prevention in a much deeper way.
We as a state are recognizing the gravity of the crisis, so we're taking affirmative steps to address it. I think we have a lot to be proud of, but until we can drive down the number of people who are dying and substantially reduce the number of people who are addicted, there are no victory laps. We have to do a much better job helping people access treatment. We have more than 1 million North Carolinians who don't have health insurance, and a disproportionate percentage of those are people struggling with addiction. We need to do a better job reducing the stigma that surrounds the chronic illness of substance use disorder. People who are struggling with addiction need to feel that they can actually go see a medical professional and get that disease treated.
The stigma that's attached to drug addicts and to parents that have raised children that turn into drug addicts, that stigma is definitely there. My parents asked me, what do you want us to say to people? What should we say when we go to church? And I said, you say what happened. You say that she had a drug overdose. And I said, you talk about it. It needs to be talked about openly. I mean, this is something that is killing the next generation that's coming up behind us. This epidemic, it's killing them.
I've probably known 6 other kids that have died since Michael. I mean, I've personally known them, not just I've heard of them, I've personally known them.
I think there's a whole multitude of things that need to happen.
Education, awareness, breaking down that stigma so people aren't afraid to talk about that it's happening.
Last one is a rotten egg.
We talk a lot about Michael, just memories. It's fun to keep Michael alive in their eyes like that.
They are in a loving family now. And I think that we're going to show them love and continue to show them love as they get older and be honest about their father's death.
I just think there's so much negativity around that I think when it comes out, I think they'll have to come to terms with it and hopefully be able to be honest to others who ask, well, how did your father die?